This is Breakthroughs, a podcast from Northwestern University Feinberg School of Medicine. I'm Erin Spain, Communications Director at Feinberg. As the U.S. and much of the world has been social distancing to prevent the spread of COVID-19, the loss of in-person contact with friends, family, and colleagues may cause some to feel lonely, depressed, and anxious. But finding ways to stay positive may curb these feelings. Judith Moskowitz is a social psychologist and professor of medical social sciences here at Feinberg and studies the impact of positive emotion on health-related and other life stress. She joins me to discuss her research and things you can do to increase positivity during this time. Thank you so much for joining me.
Thank you. Thanks for inviting me.
Before we get into your work and recommendations, how are you doing after so many weeks of social distancing yourself?
I think, as well as can be expected. It could be so much worse. So I'm sort of focusing on that, and we're doing fine.
Well, we're talking via Zoom, a platform that's really exploded in the past few weeks. Video chatting like we're doing now, is this a good substitute for that in-person interaction that so many of us are missing?
Well, I think it's a substitute, perhaps our best option for now, given that we can't see each other in person. So I really recommend for people who are isolated at home and missing their friends to reach out. The video really helps when you can see the other person. But even telephone, again, it's not quite the same as seeing each other in person, but it's a good substitute.
And there's also a lot of parents right now who are doing double duty. They may be feeling like they're having too much interaction with their children right now. What advice would you give to parents who are trying to stay positive themselves, but also help their children stay positive? Do you have advice for this crowd?
Yeah, I think the first thing is lower your expectations, particularly for parents who are also trying to work full time, who are, able to work from home. You really can't expect yourself to, put in a full day's work and help with your child's distance learning, or, if they're not in school yet and they don't have structured lessons set up with their school, preschoolers. You really just let those expectations go and just know that you'll do the best that you can for this period of time.
You're a principal investigator on several NIH-funded trials of an intervention designed to increase positive emotion and improve physical and psychological well-being in people experiencing many different types of life stress. Just tell me a little bit, how did you get into this work?
This work started 20-something years ago when I was a postdoctoral fellow at UCSF, and I was working on a study of caregivers of their partners with AIDS. So this was the early to mid 1990s, and the treatments for AIDS were not particularly effective. So it was essentially a terminal illness, and these caregivers were caring for partners who were getting sicker and dying over the course of the study. So we were studying some of the most stressful experiences that a human can experience. Sort of the sickness and death of a loved one. And we were coming at it very much from a stress and coping perspective. So what's stressful about this situation? How are you coping with it? And then that was the end of the interview. And then we're saying, we'll see you in 2 months and we'll talk again about what's stressful and how you're coping with it.
Yeah.
And shortly after the start of the study, the caregivers pointed out that we weren't asking about the good things that were going on, which really surprised us. We were like, well, what do you mean good things? This is horrific. And it's true. It was horrific and incredibly stressful. And the caregivers were very distressed and very depressed. But they were also experiencing moments of positive emotion, and they wanted to talk about it. So that was sort of my first clue that, even in the midst of whatever kind of life stress you're experiencing, it is possible to experience positive emotion, and that positive emotion can help you cope better with what's stressful. So that sort of set me on the path to designing this program where we teach people skills for having more positive emotions sort of on a daily basis, which then helps them sort of maintain their psychological and perhaps physical well-being even in the midst of some significant life stress.
And now this intervention, you've used this with dementia caregivers, high school students, people with type 2 diabetes, women with breast cancer, and as you mentioned, people living with HIV in many different groups.
We've also delivered it in a number of different formats. So you can deliver these skills in person, individually, in groups, like we did in the high school students. That was a classroom delivery mode. We've also moved it so it can be delivered online in a self-guided format. So we've just completed a study of people with elevated depression and found that this is feasible and acceptable, and they can learn these skills sort of on their own. And it does help improve their depression.
Well, today there are 8 of these skills that you work through in these programs. And we want to talk about some of them today that can maybe help people right now who are listening. Again, these are skills that you have tested time and again through trials. So please share with me a couple that you think could really help people at this moment in time.
Any of these can be helpful. And I'll preface sort of launching into these by saying this isn't sort of a magical package of skills, and you don't have to do them all. Try 1 or 2 of them, see what works for you. And then that's the one you should keep going with. Whatever one is easiest for you to sort of continue doing is the skill that you should focus on. The first 3 skills, and they sort of come as a set that I think can be really helpful on a daily basis, are noticing positive events, savoring them, and related to that, gratitude. So noticing positive events are, particularly when things are really bleak and really stressful, it can be hard to see that anything good is going on. So this is a skill you develop to notice that there are good things. So this is what the caregivers were telling us back in that study of AIDS caregivers, that no matter how bad it is, if you just look a little bit beyond the stress that you're sort of having to focus on, there are good things happening. A lot of good things that I see happening sort of in the broader society right now are the people, the healthcare workers, the grocery workers, the delivery people, the people who are really stepping up to provide essential life-saving, life-supporting services. It's really incredible. And I think, if you can just take a moment to think there are good people out there doing the really hard work that we're going to need to make it through this, that really helps sort of noticing that piece of it. When you're confined at home, for example, with a small child, you can create positive events with them. So just, taking a moment and sitting with your child and reading a favorite book, or creating a piece of art, playing a new game or an old game, just, taking a moment to really enjoy the things that, you've always enjoyed, and really being able to focus on that. And then related to that, sort of noticing of positive events or creating of positive events is savoring them. We also call this capitalizing or amplifying the positive events. And this is just noting in your journal that this great thing happened today, or telling someone about it, or even just thinking about the positive event gives you the opportunity to sort of get that hit of positive emotion again. Sort of similar to these is gratitude, just taking a moment to notice the things that you are grateful for, and it can be big things. This can be a religious or spiritual thing. It doesn't have to be. I'm looking out my window right now and seeing that the sun is shining.
Oh, that's always a good sign.
Fills me with gratitude. It is just, the gray days are really hard. So when the sun comes out, I try to really appreciate that. And I am grateful that the sun is out today, and that spring is definitely coming. And I've started to see some of the plants,
flowers popping up
through the still very cold, the very cold ground still. So just, again, it's a matter of taking a moment and sort of pausing in, the daily list of worries and to-dos, and noticing something that you're grateful for. And that can be tremendously helpful in sort of increasing your positive emotion.
I want to talk a little bit about social media. I know a lot of people are on social media sharing news. There's a lot of as we know, negative news stories happening, but there's people using social media as well to connect. And there's a group right now that's, cutting out hearts out of construction paper with their kids and putting them on their windows and doors as a way to connect with other folks. Are little activities like that and sort of creating these movements on social media, could that be part of this approach of showing gratitude and coming together?
Yep, absolutely. Yeah. I mean, social media is really a double-edged sword, right? I know
Right.
I have to be really careful in how I'm taking in news and how frequently I'm taking in news, because my tendency is to do it constantly. And
Mm-hmm.
that can really be overwhelming. So it is really helpful if you can also seek out the positive things that are going on social media. I think it can be a great connector as well. So that, again, if you're feeling socially isolated, but yeah, so in terms of creating positive events, I've seen the heart cutout thing. I've also seen
Yeah.
something about teddy bears in windows
Right. Teddy bear
that's
hunts.
related. The bear, yes, the bear hunts. Yeah. So I mean, those are really sort of moments of joy that if we can
Yeah.
just, again, sort of take a moment to appreciate that or to engage in that, it can be really helpful.
Another thing that you can talk about is setting these attainable goals each day for yourself. It can be,
Mhm.
we were joking that it can be like Groundhog's Day. Every day you wake up, it's the same again.
Right.
Um, so how do we do that? How do we create those goals?
This is based on research that shows that even the perception of some progress toward a goal increases positive emotion. In the context of coping with our, extended social isolation, or needing to stay at home, what I've been doing with my family is every morning I text the family group chat. I'm at home with my husband and my kids, so there's four of us here. I
Yeah.
text them the things that I'm going to do each day, and it's like simple things like get outside 2 times. Work stuff
Hmm.
is like one bullet point. They don't get the details on that, but that's my other list. The a few work things that I can manage to get through. Get some exercise. Uh, you know, Read 10 pages in a novel. Like even goal, like things that you wouldn't normally put on your to-do list. I think in a case like this, it can be really helpful. Get a load of laundry done. So
Yeah.
things like that.
Yeah.
So, or
Yes.
normally you'd be like, well, of course I'm doing that. Like that's not a sensible, attainable goal, but it really is, especially in times like this where it's every day seems just the same. So if you're like, well,
Hmm.
but yesterday I did these 5 really minor things and I wrote them down and I
They
crossed
add
them off
up,
and I
right?
feel really good about that. Yeah. So I think just, making sure that those goals sort of hit that sweet spot between, I mean, you don't want like, I'm going to write a novel while I'm home, homeschooling my
Right. No.
3-year-old, right?
Right.
No, that's not going to happen.
Right.
But maybe you can, read a few pages in a novel, right? So
Sure.
the trick and the important thing is to sort of make the goals at that point where they're not so easy that you could do them no matter what, but they're not so challenging that you'll fail, right? So
And that's kind of, yeah, and it's kind of being kind to yourself with those goals
that's right.
too.
That's right.
And acts of kindness and understanding acts of kindness is something else that we can do.
Yeah, and I think, I mean, you touched on this a little bit with the cardboard hearts. I mean, that's an act of kindness for a child who's out and sort of hunting for those hearts,
Yeah.
right? I think one way to reframe the sort of mandate for us to um, engage in social distancing is that, it's not it's certainly an inconvenience for us, right? Like we don't want to have to do this. This is very disruptive. But think of it as an act of kindness for someone else who, if we all engage in this social distancing, we're going to help a lot of people not become infected.
Yeah.
Right? We're going to flatten the curve. It's the right thing to do, and it can help a lot of people. So if we can sort of focus on how this is actually an act of kindness, there's really great research showing that doing nice things for other people actually benefits our own well-being. So one really great study that was done by Elizabeth Dunn several years ago now, she brought people into the lab, community members into the lab, and measured their happiness, and then
Yeah.
randomly assigned them to either give $20 to someone else that day or to spend it on themselves, right? They were all given $20 and they were randomized to give it away or to spend it on themselves. And then they didn't know it, but then they were called back at the end of the day and asked how happy they were. And the people who spent the money on someone else were happier than the people who spent it on themselves. And it didn't
Cool.
matter what their income was.
Wow.
So just the act of doing that on someone else, and they had a $5 condition as well. So even just a little bit of money spent on someone else was really helpful. And these things don't have to be things that cost money, just any act of kindness. Put a note on your neighbor's door that, when you're going to go out for groceries, that you'd be happy to pick something up for them. I mean, things like that wouldn't necessarily cost you money, but can help someone else.
You mentioned there's another thing that isn't usually in your list of 8, but it's important and it's kind of implied with all of these steps. Tell me about that.
So this is self-compassion, which when we put together the original package of 8 skills, the self-compassion research was just sort of coming online. So we didn't explicitly include it. I think it's always been implicit, like sort of, cut yourself some slack, don't beat yourself up, don't judge yourself for feeling bad. A really important sort of foundational piece of our program is that life is hard, life is stressful, bad things happen. It's normal for you to be feeling some anxiety or some depression or negative emotions. Like, that's normal. And this is not about just ignore those negative things. Pretend everything's fine. Let's all be Pollyanna and just, put a smile on our face and ignore all the awful stuff that's happening. That is not what we are.
Right. It's not human, right? We can't.
That is absolutely not human. That is not what the goal is here. Instead, we really try to help people have more sort of self-compassion and understand that, we're all in this together. Everyone is suffering in some way, whether it's our own individual things we have going on or the broader stressors that we're all experiencing right now. And if you can sort of, again, sort of cut yourself some slack, like, you don't have to be functioning at the same high level that you always function at, or even your lower functioning level that you might be functioning at. It's really just have some compassion for yourself. Do something nice for yourself. Understand that all your emotions are normal. And, if you need help, reach out for help. It's really important to know that you're not alone and that you're not the only one feeling this way.
People are doing online therapy. They're doing phone therapy. This is becoming more popular in recent weeks, and it seems to be working for a lot of people.
Yeah. And it's really critical, I think, for people who do have pre-existing depression or anxiety. This can certainly exacerbate it. For many people, that weekly therapy appointment is absolutely critical. So it's really great that we've been able to move to sort of this telehealth model, and that therapists are able to see people remotely, because it's really important.
There's a lot of people in this country right now who maybe have a more mild case of coronavirus, or it's just starting to affect them and they're worried about how bad is this going to get. Do you think some of these steps of your program might be able to help people who are experiencing COVID-19?
Well, of course, I don't want to get beyond the data, beyond our own data. So we don't have information on that, but the mind-body connection is very real. There is a huge body of evidence showing that people who are able to maintain their positive emotion, or who have more positive emotion, are healthier. So there's that piece of it. And there have been some really great studies done by Sheldon Cohen, who's at Carnegie Mellon in Pittsburgh. And he did these great studies where they brought people in and intentionally exposed them to a cold virus. And then they quarantined them and saw who developed the symptoms, who actually came down with the cold. And they found that the people with more positive emotion were less likely to become infected.
Wow. Okay.
And that was, independent of their negative emotion or other things. So there's definitely the possibility that if you're able to maintain your positive emotion and, lower your stress as a result, that you could remain healthier. Again, I don't have it in my studies.
Right.
But the literature is there to support that it's a reasonable hypothesis.
Thank you for sharing some of these steps with us, because I think there are a lot of people right now, as sort of the days and weeks drag on, they're trying to find ways to stay positive. And I think this is going to help.
Great. I'm glad.
Thank you so much for joining us today.
Great. Thank you. I really appreciate you calling.
Be on the lookout for more Breakthroughs episodes coming shortly, featuring Northwestern medicine experts speaking about COVID-19. And head to our website, feinberg.northwestern.edu, for show notes, resources, and to claim CME credit.